Good morning, good afternoon, good evening, friends around the world. My name is Professor Bettina Borsch. I am the CEO of the World Federation of Public Health Associations. And today I have the pleasure to be with Dr. Ruediger Krech. Good morning, Ruediger.
Good morning, Bettina.
And Dr. Ruediger Krech is Director, Health Promotion at the WHO headquarters in Geneva. And in addition, he is a long-standing friend and supporter of our World Federation. Thank you for that, Ruediger. Very, very much appreciated. Today, I would like to start to ask you about your topic, health promotion. And we know that health promotion is one of the pillars of public health. Today, we have over 110 conflicts, armed conflicts around the world. And somehow health promotion has to be there as well. So please, could you explain us how health promotion has to be everywhere at every time with every human being?
Yeah, thank you, Bettina, for that question. Now, as leading the health promotion work in WHO, we know very well how the different instruments we're applying in health promotion work across the spectrum of public health. So, for instance, we're working on community engagement. And we know in pandemic situations, in emergencies, how important it is to work with the communities based on the trust that you in the health system have built up, let's say, during peace times. So therefore, to think that emergencies or preparedness for pandemics could work without community engagement and participation would be a huge shortcoming. In public health, we need to work across these different pillars that Bettina, you've just talked about. So how do we promote and protect health? How do we actually prevent disease? How do we protect people from emergencies? And how do we actually make sure that people receive the health services they need without falling in poverty? So these three different strands of public health need to work hand in hand. And that is what we're doing in health promotion as well. So let me give you another example of empowerment, where we say that health promotion is to enable people to take control over their health and lives. Now, what we've seen during the last pandemic, the COVID-19 pandemic, was that many of us actually handed over the control over our lives to governments, who then drew up public health measures who might have worked very well, but at times were not very clear to people why these measures were introduced. And that is exactly what we need to prevent from happening another time, because people need to understand when they're giving away this control over their health and lives, why they would do it. And they will need to see the immediate benefits of these public health measures for their own safety and that of their loved ones. If they do not see these added values, they will oppose. And that is what we've seen, especially during the later waves of the pandemic under COVID, where governments had a hard time to justify that, for instance, you would close schools just like that, but you would open public transport, right? So Where then in the families, people would say, but the exposure to risks is at least as high as if our kids would go to school. So, and I'm including here the guidance and guidelines that came from WHO. We need to radically review how we're giving this guidance. So, because, you know, the action is at the local level, in the very school, whether they can comply with the requirements of, hygiene. In the case of COVID-19, it was clear that 1 meter and 50 centimeters would be the adequate distance we needed to keep between one human being and the other to not infect another person. How can we actually apply this in this very one school where the building facilities might be looking very different from the school building of another school somewhere else? So when we're coming to the guidance, we need to make it workable at the very local level. And secondly, we need to apply a systems view. And that means that we're looking at the different aspects of these, following these hygienic rules throughout the day of an individual. So if I take back the example of a school, which we easily just closed, we then also need to see, how does a child get to school? How is it during the school time, and how is it afterwards? How is it in the afternoon and in the evening? So throughout the day. And if we're not making these links, then actually we're exposing the child and therefore the adults, the families, to other public health risks. So in public health, we need to be very clear that we need to apply this systems thinking to the public health guidance that we give. Right? So this is just one example, Bettina, how I think health promotion can add value to the guidance we give in public health emergencies.
Thank you very much. So health promotion informs all the other sectors, especially during complex situations. And if we think, you talked about the pandemic as an example, we have had the World Health Assembly 77 now, just 2 weeks ago, and there was a lot of talking about the last pandemic, for sure. We have seen the amendments on the international health regulations, and we have seen a lot. How was the World Health Assembly, the last one, the recent ones, for you, especially if you look with your lens? You just mentioned health promotion, the system thinking. How did you think that was taken up in the World Health Assembly 77?
Yeah, thank you very much. And first of all, to say, just to pick up on your last comment, I think health promotion is not just informing pandemic preparedness. It is actually offering a different way how guidance is done, right? That means that we would ask questions to be answered at the local, very local level, in the very school, benchmark questions that they can answer, and then from that draw up their own guidance. And we, as authoritative agencies, as WHO, as a national member state, as a regional authority, would actually give guidance what needs to be taken into account from a public health point of view. That means it's a very different way how we are setting up guidance. And that needs to be understood, because at the moment, we think that we can actually have a guidance saying this is what you need to do, and therefore you close schools. And while I would say this needs to be done in a local manner. So this typical global local connection that we have vast experience about in health promotion. So just to be clear on that one. Now, coming to the World Health Assembly, it was very rewarding, I would say, to see member states' reactions to both health promotion and disease prevention. We had a huge debate around non-communicable diseases, what has happened during the pandemic, because the overmortality during the COVID-19 pandemic was by and large caused by people not receiving the services on non-communicable diseases, i.e. cancers, cardiovascular diseases, diabetes, and respiratory diseases. They needed, and therefore they died. They were not early detected, they didn't receive the treatment, and the overmortality, which if you take everything together during the time of the pandemic, was about 15 million people. Only 8 million from that died of direct interlinks with COVID, and the rest died because of other instances, and that by and large was NCDs. So we have a huge agenda also when we're talking about chronic diseases during a pandemic. We need to get it right next time. How can we ensure that people do receive the services they need for their non-communicable diseases, even during a pandemic's time? And again, applying a health promotion lens to it will help us to understand how guidance and hygienic requirements will be met also during a huge other new pandemic. That's one thing. And that's why it was rewarding to see the huge debate we had on NCDs with over 150 member states wanting to support our NCD agenda in health promotion and disease prevention and management of NCDs in the world. A second important thing is that member states understood that we cannot just go back to before COVID times and just forget about what has happened. We need a radical shift to address the major risks for a new pandemic. We also need to understand with the other crises you were talking about, 160 crises in the world at the moment, by and large are triggered through climate change, through social disruption, through misinformation and disinformation in social media that actually spurs other crises, and of course war, that some individuals, let me say, think that the weakness that we have in global governance at the moment, coming out of a weakened situation during COVID, they can exploit to actually run and just have a war to actually increase their power base. That is to be condemned, and that is what member states did by and large during the assembly. But it also shows that we need a radical rethink of societies. So therefore, I was very happy to see a huge debate around well-being societies, where we need to put values in place. What are societies that we want to live in? And how do we put measures in place to combat the misinformation and disinformation in the net? That we are addressing the technological innovation for its opportunities, but also understanding its risks. And how do we actually make sure that we're not exploiting the planet beyond the planet's capacities to rejuvenate? So we have a huge agenda in front of us, because all these strands of our life have impacts on people's health and well-being. And that is why the work on well-being societies, together with other UN agencies, with other regional entities, with banks and financial institutions, is so important that we're getting things right, that it is for people's well-being and their development that we're running economies for that purpose, and not just for the profit of very few industries. Very few industries are actually responsible for 80% of the disease burden that we're facing, like tobacco industry, alcohol industry, food, junk food industry, and fossil fuels, right? We have very good reports of that, and that triggered a lot of debate during the assembly to understand that these very few profit industries need to be better governed.
Thank you so much. That is your view on a real global connected systems problems that we do have. And if we come to the, let's say, written results of the World Health Assembly, I think, in fact, it was very positive that we have well-being society and that we talk about, finally, about how our societies have to be governed and what will be our model, and if we want a new social contract and things like that, very important. But then there is also the legal work to be done. There were successfully at the very end, the international health regulations, the amendments to them, and a little bit longer working on the possible pandemic treaty. What are your views on the IHR amendments, first of all? Do you think they take into account the things you mentioned right now?
Yeah, first of all, let's put it this way: we were successful in the very last minute, right? So which shows again the importance of global health work in WHO. It's an important step forward, I would say. And WHO is the only forum where member states can actually agree on what to do in a next pandemic. So just to also say, for those people who think, oh, is it too much of a power that we're giving to WHO? Let everybody be assured it is not power to the secretariat of an organization. It is giving power to all member states, and that is what member states agree upon. It is not something that you give power away as a government to an organization, whatever it's constructed. So that is important to note, but this is important also to understand that some of global health issues cannot be resolved at national level alone. And therefore, let me come to my own personal judgment. It's definitely not the judgment of the organization, but my personal one. And I'm just to give a little bit of background, I was very humbled and honored to head the secretariat of WHO after the Ebola pandemic in 2015. So I have a little bit of experience and had a huge learning curve also from my public health knowledge and experience to understand how the structures of agreements, of mechanisms work when it comes to notifying other member states that there has been an incidence of of a communicable disease, which is unusual, right? So with all this, my experience during the 2015 review of the international health regulations was that, how shall I say this? This is a Swiss cheese, as we are in Switzerland here in Geneva, a Swiss cheese with a lot of holes, right? And then an external committee of experts from various strands, from epidemiology, from military, from social science, from the academic world, but also from the clinical work, at that time identified major shortcomings of the IHR. And what was very obvious during the Ebola pandemic, and interestingly enough, we compared those recommendations in 2015 with the recommendations that were done after the swine flu H1N1 pandemic, which were very similar. Now, with the revisions of the 2024 IHR, I see that some holes have been closed. There's more cheese than holes. But honestly, Bettina, if a next pandemic hits us, a pandemic isn't looking at the international health regulations. A pandemic will actually run and get into the world as the virus suggests, and the virus opportunities. And it is in the nature of viruses to actually exploit every shortcoming, every weakness. And between you and me, there are a lot of weaknesses still. For instance, the IHR does not speak about how we're communicating with each other in a pandemic. To give you an example, a broadcast wanted me to be part of a panel, a talk show. And then they said, oh, it's great to have you there because you have all this experience and from, both parts, emergency preparedness and pandemics and health promotion. So that would be very helpful to us. And I said, of course, with pleasure. And then they said, oh, but, we need to actually also, get somebody who is of a complete different opinion to spice the discussion a bit up. And then I said, well, perhaps then I'm not the right person to come, because number one, I do not think that a pandemic is the subject of a talk show, which is talking and a show, and it's not to entertain people. So I think we need to learn also in communications how to distinguish between opinions that are shared by 98% of all experts or the 2% that might have very different opinions, but perhaps not based on evidence. And that is a big thing for us, because what we have seen during the COVID pandemic was that another pandemic was overriding the COVID pandemic, which was a pandemic of mis and disinformation in the net. All sorts of, theories were actually shared there. And there is no accountability attached to actually bringing those opinions without any evidence into the world. And that is a huge problem in today's world with the social media, which actually then contributes to a social disruption of societies. And that is a completely different, big risks for the world when it comes to a next pandemic. And the IHR do not talk about this very much. To just give you one example, I could give you many, many more.
Thank you for your personal, really personal also appreciations of what has happened recently and what we have to do. I see that it was so rich what you shared with us that I just dare to ask you a very last question. You know, we are in front of, together with the worldwide members of the World Federation of Public Health Associations, what would be your key message, wish to all our members and public health people around the world now?
Yeah, Bettina, you know, the World Federation of Public Health Association is a core partner to us. You're our friends, you're our allies. And I just would like to say how important your voice is. Your voice as a global association, but also the individual members, the national associations of public health, the institutions of public health, in which are actually assembled in NIANFI, a sister organization of yours. These voices, your voices, are crucial, and they need to come much more to the fore now during peace times, when it comes to how do we prepare our own national governments for the next pandemic? How do we look at our infrastructure? How do we review our preparedness? You know, it's all much too theoretical. And what I also can see, what we also had seen in 2015, you know, some of the member states representatives came to me and said, "Oh, Ruediger, you know, we understand what you say, but we're tired. We want to get back to we want our lives back. We want to get back to normal. So while we understand, but we cannot afford doing this." And that is what we have, this déjà vu now. And we have seen it during the very difficult negotiations as well. You know, people got tired, but we need this extra mile now to actually prepare for the next time. And that is why your voice of the World Federation and the voice of the national associations of public health, you know, are so important. Bring it to the table. Actually raise your voice when your politicians want to actually get back to normal and say, we're not there yet. We need preparedness, which is like a fire drill, not a tabletop exercise where you have a little nice role play for a couple of hours. In fire, we have in many countries fire drills that you actually go through what happens if your, you know, office building or your school, your hospital has a fire. We know what then to do, and we know it because we're doing it twice a year. This is what we need when it comes to pandemic preparedness as well. Not just theoretical little things and plans which land in the shelves and in the drawers, but the concrete preparedness, you know, that we go through. What do we now do when it hits, when the next pandemic hits us? So much more pragmatic and not just plans which are not implemented.
Thank you so much. Thank you, Ruediger. And I think I can assure you that we at the World Federation will go not the one extra mile, but several extra miles together with you, with WHO. So thank you very much.
Thank you very much, Bettina, for having me today.